Hello, Mr. John. How
Well,
are you today?
not bad, but I have a lot of pain here.
Yeah, on your shoulder, I understood.
Yeah, it's in my shoulder.
Yeah,
It's a lot of pain. I don't know what can I do. I cannot just move it this way.
yeah,
Yeah.
yeah. So, according to our previous session, what we did for a diagnostic, I went through some examinations
Okay.
to find out the problem on your shoulder and the subacromial pain syndrome examination that I did. They were actually positive. That shows that you have problem around your shoulder
Okay.
and is related to the muscular tendon around your the head of the humerus of your
Okay.
this bone of your
Mm-hmm.
shoulder.
Okay.
So and you're suffering for with this pain for 6 weeks, and according to all the research and guideline, still you are not in a chronic phase.
Mm-hmm.
You're it has a most of the people 30% of people they get better after 6 weeks, but it's also possible that it takes longer.
Mm-hmm.
So you shouldn't be much worried about this pain that you're having it for 6 weeks.
Okay. Yeah. But I don't feel it really well because I think according to my research in the website, if something's broken in my shoulder, I don't know why, but I really fear I cannot do it because I search in the website that something is broken in it,
Yeah,
or I can just heal it or not. But I don't know.
yeah, I
What.
understand, but the most important thing is that you you shouldn't be that worried. I can make you sure that nothing is broken.
Mm-hmm.
If actually you think this way, that will sensitize the pain that you have.
Mm-hmm.
What you can do is that you should forget about something is broken here, because I can definitely say that nothing is broken there,
Mm-hmm.
and it's just pain around the shoulder, because your muscles and tendon around shoulder are getting a little bit weak,
Mm-hmm.
because you are doing repetitive movement around above your head,
Mm-hmm.
and we're gonna work on that. We try to strengthen the muscles around your shoulder, and if you keep thinking that way negatively about something broken, that would enhance actually the pain.
Mm-hmm.
You know, because pain is not all about here and the structure. Pain is gonna be formulated in your brain,
Mm-hmm.
and negative thoughts and negative feelings about the pain would enhance the pain,
Mm-hmm.
and will be a very uh, bad effect on that.
Okay.
Because pain is more like is not always related to the constructional level. Sometimes you can have no injury or anything, but your brain will be
Mm-hmm.
sensitized and create some pain.
Okay.
Like if you imagine a car that has a alarm,
Mm-hmm.
your brain works like a alarm. And if
Okay.
the alarm be so sensitive, like imagine you have an alarm car and just a cat walks around your car and it starts alarming,
Mm-hmm.
and which uh, is not really true. It's just oversensitive, and your brain would work also like that.
Okay.
So, but with positive thinking, with positive uh, yeah, thoughts, will decrease your pain. And
Mm-hmm.
I'm gonna show you that you actually can move your hand, and there's nothing that you
Mm-hmm.
can be worried.
Okay.
First, I'm gonna. Do you have other questions?
Yeah, I just want to just get back to work and do the things I before that
Yeah,
before I did it and just heal it.
I understand.
Yeah.
Yeah, I think you still have time to heal. Yeah, some people it takes even till a year that they get rid of
Okay.
Subacromial pain syndrome. You shouldn't be worried. It's not something, nothing serious is happening there. Nothing is broken. It's just you have to work on the strength around your muscles. And I'm gonna show you that moving your hand wouldn't be that painful and that fearful.
Mm-hmm.
You ready for that?
Yeah.
Okay, that's
But
good.
it's nothing. But it's the feeling is in the broken here.
Yeah, I understand.
Is it incorrect? You mean? It's not something in broken here.
No, it's not.
Oh, okay. Yeah.
Don't worry. So first, I'm gonna show you, and I'm gonna move your shoulder passively, and
Mhm.
you just let me know if you had any serious pains.
Okay.
Yeah, just relax. Yeah. How does it feel?
Yeah, it's a little pain.
Yeah, but it's still doable, right?
Yeah, it's
If you wanna tell me in a scale of 0 to 10, how much pain do you have?
it's I think 6, 7. Yeah.
Okay. So you see, it's still doable, and it's always good to
Mm.
work on it. Yeah.
Yeah.
Okay. So, okay. Do you see now? You can actually move it. You shouldn't be
Yeah.
just now. Can you do it actively for me? Probably not. But I try to
Yeah.
do more. I'll just try to not. I don't do it. Oh, good. Voila. Oh, yeah, great job. Oh, don't worry. We are working. We're gonna work on that.
Mm-hmm.
We're going to actually strengthen the muscles around the head of humerus, the head of this bone here.
Mm-hmm.
This is a very shallow joint,
Mm-hmm.
and there are a couple of muscles which they are actively their responsibility is to keep the head of this bone
Mm-hmm.
into this shoulder,
Okay.
into this joint.
Mm-hmm.
We're gonna try to strengthen those muscles.
Okay.
That's the head of the humerus will stay perfectly in the joint.
Okay.
So what I want you to do is that can you stand up?
Yeah.
So I want you to put your feet on this thing and try to bring it
Mm-hmm.
till here. Yeah. Can you do it?
With this one.
Yeah.
And like that.
Yeah. Very good. Yeah. 2.
This way. Yeah.
This way. Yeah. 3. 4. No, just 6, 7. One more. We do 8. So that's the fact that you are able to do it means that is a very good actually right amount of pressure on the shoulder.
Okay.
And we're gonna do 4 times 8
Mm-hmm.
to strengthen the
Okay.
muscles around there. So it's one exercise. Do you have something that can you buy something like this at home?
Yeah. Actually, I have it. Yeah.
I want you to do it 3 times in a week
Mm-hmm.
with the same technique that we did right now.
Mm-hmm.
Yeah.
Mm-hmm.
So the other one we're gonna do is that.
Okay.
So what we're gonna do is that I'm gonna push here.
Okay.
Yeah.
And let's check how much. I mean, here.
To here.
Like
Yeah.
that.
Yeah. Perfect. Good technique. Yeah.
Can I just with the help of my hand or without help?
No, just without.
Oh.
Yeah. 5, 6, 7, 8. That's good. So you see this one, right? You can also do it at home.
Yeah,
Can you create something like this?
Yeah, I can. A hanger, and yeah, I can do it.
So with this exercise, we are trying to strengthen the muscles which are responsible for doing the internal rotation of your muscles around the shoulder, and with the other one, more external rotation of the.
Okay.
And this is more functional to use because you do lots of above your head activities. So if you please take a seat again. So, how do you feel now? Do you have?
Now, yeah, it's really surprising I can do it because I thought if something's broken and I cannot do anything.
Yeah.
But I have pain now, but it's really positive that I can now move it.
Yeah, that's a good progress. And trust me, don't worry. It's nothing broken. All the tests we did, the previous session shows that nothing is broken. It's just something we call subacromial pain syndrome. And the course is a little bit longer, but as far as I see, you're doing good, but you should just stop thinking about that something is broken.
Okay.
And keep doing these exercises. And then next week we're gonna a little bit increase the weight, so that you increase the muscle strength around your shoulder.
Okay. Yeah.
So everything is clear.
Yeah. Everything's good. Yeah.
So
I need to do these things in my home, or?
Yeah, 3 times in a week.
Okay.
Like do Monday, Wednesday, and Fridays.
Okay.
And each session we do 4 times and 10 repetitions.
Okay.
Yeah. Is that clear?
Yeah.
So see you next week.
Yeah. Thank